This presentation is on valley fever, and it was created by Mindy Cooper, Rebecca Brown, and Gagandeep Kaur. Valley fever, or coccidioidiomycosis, is a fungal infection caused by the Coccidioides immitis. This disease is transmitted via coccidioides, which are fungus spores. Valley fever is not contagious from person to person. However, an individual can contract the spores from breathing contaminated soil. Some animals, such as canines, can also contract the disease. It is given its name due to its prevalence in the San Joaquin Valley area. If you want to determine if your patient has valley fever, a blood sample is necessary, and it's the most accurate way to detect antibodies or antigens. This slide is one of the photos that shows various concepts that we'll be going over in this PowerPoint. I think one of the main things we can focus on is that there is no cure for valley fever. Most of the patients will not receive any treatment for valley fever, and 60% of people infected don't even know that they have it. The organism is known to live in the soil and is predominantly found in southwestern parts of the United States, Mexico, Central and South America, and recently is north of south central Washington. Coccidioidiomycosis spores grow in areas of heavy rainfall and are typically contracted during dry, hot conditions. When dust or soil is disrupted, the coccidioid spores are inhaled and can possibly infect the individual. In uncommon cases, valley fever can be transmitted via organ donation from an infected donor, inhalation of the spores from an infected wound, or even a fomite. Once contracted, the body develops immunity to the disease. Anyone can contract valley fever. However, there is a population that's more at risk. That includes the farming community, anyone aged 65 or older, Black and Filipino individuals, pregnant women, people who smoke, individuals who have diabetes mellitus, immunocompromised individuals such as HIV, AIDS, or if you are on corticosteroids, and anyone who has an organ transplant. That puts you all at risk to contracting valley fever. Valley fever can easily be contracted by being inhaled through the nose and mouth when contaminated dust and soil is suspended in the air. After the spores enter the lungs, the person's body temperature allows the spores to change shape and grow into spherules. When the spherules get large enough, they break open and release smaller pieces called endospores, which can then potentially spread within the lungs or to even other organs and grow into new spherules. This phenomenon leads to disseminated coccidiomycosis. Disseminated coccidioidiomycosis, also known as disseminated valley fever, is a more serious form. It is uncommon though. 1% of the infected will experience this complication. The spores can travel from the lungs to various parts of the body in this condition, can range from the liver, bones, skin, brain, meninges, and heart. The symptoms can vary with coccidioidiomycosis and disseminated coccidioidiomycosis. For traditional valley fever, you'll see fatigue, cough, fever, chest pain, night sweats, muscle pain, rash, and joint pain. Most patients state that they feel like they have a common cold or even flu. With disseminated valley fever, most typical signs are joint swelling, skin lesions, nodules, or even meningitis. Valley fever onset is anywhere from 1 to 3 weeks, and the symptoms can last anywhere from a few weeks to a few months. Perhaps as many as 60 to 70% of all people infected develop no symptoms at all. Some 30 to 40% of people do get sick, usually within 1 to 3 weeks from the cocci spores entering the body. And this brings us to treatment. Since the disease cannot be treated except with severe cases, the main focus is prevention. We can educate the public on the importance of wearing face masks or shields in areas that have a lot of dust or dirt. Emphasizing the importance to field workers of face masks is also important as well. This is a self-limiting illness, so most patients do not receive any treatment.
The symptoms do resolve within a few weeks to a few months. Your doctor will recommend adequate rest. And if they do require treatment, fluconazole or other antifungal treatments are the go-to. They're typically given to patients who are at risk of developing severe valley fever symptoms, and 5 to 10% of people will experience long-term lung infections. And finally, this is a list of our references that helped us develop this PowerPoint. I hope you enjoyed our content and you learned some insightful knowledge on valley fever.